Before we start the session, I always do say this, but I want to send good wishes and thanks to everybody who's looking after or supporting people who've had COVID or have had it and are recovering. And our thoughts are obviously with the people who've lost people, because that is a terrible, terrible time for all of you and families and friends. And many people will know other people who they've lost, and that's really sad. And we're also sending some healing thought for people who are suffering at the moment from COVID or this long COVID, which seems to be a really bad thing to be getting. And it's especially, I understand, hitting women more than men and lasting weeks and weeks. And we'd like to have a session on that maybe a bit later in the season. And it's a very difficult time for many people in the country because of the restrictions that have been coming in over the last few days. So at least some people will be able to join us because they're stuck at home and they can't do much else. So welcome to those people if you're one of those. Also, big thank you to all the NHS workers. And I think the trouble is, as we have this second wave, maybe people aren't going to get the sort of love and thanks that they got the first time round. But we still love you, and we still say a big thank you to everybody who's working their socks off, people who are having mask problems because that the PPE is so tight and uncomfortable. So we're with you, and thank you for all that you do, and all the key workers too. Okay, little bit, and now we're moving on to this week's news. A little reminder: get your flu jabs now. They are available in all good health services everywhere, and I know that the take up this year seems to be quite good. So do take the opportunity of getting a flu jab if you can. It's still Black History Month, and there's still some really good features. I've seen quite a few things on Twitter and Facebook, and do take the opportunity to watch some things. There's a really good film about two escaped Black women, enslaved women in, I mean, must be Victorian times, and it was in Scotland. Really good clip. So if you get a chance to see that, it's only 17 minutes, really good. I should have put it on the resource sheet, which will be coming along later, and I'll find the clip and I'll put it on there so you can watch that. It's also Breast Cancer Awareness Month, so make sure you're checking yourself for that. It's also Down Syndrome Awareness Month too. And it's also, today was the start of the Fab Change 20 share. If you're a Twitter person, you'll know all about this. This is Roy Lilly and his Fab Academy. Really good sessions on all sorts of changes that are going on in all over the NHS, not just in maternity care, but in nursing, in general medicine, in hospitals, in community. And you can access it after today. They had live sessions today, but I understand you can go into the program and check that out over the next few days. So that is really fantastic. Okay, and I needed to say there's something on pressure ulcers, which might not sound relevant to midwifery, but it might be, and also wobble rooms, which we have talked about before, which could be relevant. News from the RCM, there's a student survey out which said, surprise, students are stressed and reported having insufficient time to study. This was carried out a bit before the COVID issue, but it has relevance now because obviously that's impacted a lot on their studies. And they obviously had financial issues on their programme, and the RCM are calling for 3 commitments from the UK government: ensure all newly qualified midwives students can move seamlessly from training to employment, which Anna, I think, might talk a little bit about. 2, conduct a wholesale review of financial support for midwifery students with a view to providing maintenance grants which reflect actual need. Hooray, at last. And also provide comprehensive mental health support for midwifery students. So these are all things we'd absolutely agree with. Okay, and they've also got the RCM have got a new research and development strategy, which will be of interest to many of you. Okay, well, I think we'll move on to the main meat of this evening, which is continuity of care, which in a way it's almost like a taken for granted for me. So much of the research, so much evidence to say that it's a good thing for women, for their babies, for their families, and guess what? It's a good thing for midwives, for student midwives too. We need to look at why it's not happening wholesale, maybe.
Thanks for watching this video from the Maternity and Midwifery Forum. For more expert opinion and analysis, hit the button below to subscribe.